My name's Noah Clay. I'm a nurse here in the ICU at Cheshire. I grew up in Keene and I've worked at Cheshire for about 7-8 years now. I started out as a junior in high school. I started out in the kitchen and the dish room. I worked there for about 2 or 3 years, and then I got my LNA license in college during nursing school, worked as an LNA during college, and then did some summer externships here in the ICU, which was a nice gateway to transitioning to my RN job that I accepted about 3 years ago now in the ICU. Nursing school is definitely challenging. You have clinicals 2 to 3 times a week, a lot of schoolwork, a lot of tests. So nursing school itself is definitely long, but it's rewarding. We are definitely more time crunched, waking up early, going to the hospitals, depending on the location. My clinicals were about 30-ish minutes away, so I was waking up at like 4:30 on those days, going to clinicals and classes. So the schooling is definitely a lot. It's a lot of test-based. Some disciplines do a lot of project-based. It's definitely a lot of tests and papers. It definitely is a good experience as well. It kind of gets away from just strictly the classroom environment a lot, which is nice. You're in the hospital a lot, depending on the program. I went to Colby-Sawyer College, and so we have a great relationship with Dartmouth where we spend a lot of the time outside of the classroom in the hospital itself. During my undergraduate, I was per diem, so I wasn't able to do kind of the full tuition reimbursement aspect of it, but I definitely did scholarships through Cheshire, which have been fantastic. More recently, I just finished my master's about 2 months ago. I did all of my master's through Colby-Sawyer, and so I definitely utilized the tuition reimbursement and additional scholarships from Cheshire and the Dartmouth system, which helped substantially pay for my master's. I understand that a lot of people coming out of college, they may not know yet what discipline they want to be. But I think when you get to that end of college, the spring practicum and we have in nursing, that's where you can request a specialty. So I did mine here at Cheshire. I worked my last semester in the ICU here, and it was a great transition into a job. So I definitely think that wherever a student may want to work, to definitely try to apply to that unit, because it's a great segue right into a position. I mean, there was a month from student to when I started full time, especially in this day and age of travelers and our recruitment. 90% of the time, unless there was something overt, you'll get a job offer. Hospitals want students, especially on their units, and so doing that practicum on the unit is a great segue. The work-life balance here is great. We self-schedule for nurses. Our ICU commitment is every 3rd weekend is when you're required, but we self-schedule. So I'll put in the dates that I want, and I would say 85–90% of the time they're approved. So it's very easy. I just came off of a 5-day stretch of having days off without any earned time. So it's very easy to set your schedule up to have a good work-life balance. So I think it's really plausible to have a great work-life balance here, and I think a lot of my colleagues agree with that. I really enjoy the ICU. I like the acuity of the patients. Care is really complex. There's a lot of moving pieces, but I like how there's kind of a more one-on-one relationship with the patients. You definitely get to know your patients really well, and you have this kind of continuation of care. And what they kind of call it is like controlled chaos, where the ED is really kind of hectic, a lot of moving pieces. The ICU is a little bit more controlled environment, which I like. So I definitely like the smaller aspect of the hospital. Doing clinicals at a bigger facility is great, more specialized medicine and such, but I definitely like the small community sense to it. Kind of get to know a lot of people in the hospital. It's easy to transfer people. It's easy to talk to people. There's kind of one-on-one conversations. I like that kind of more community home aspect of it than you would at just a large facility where there's just a lot of kind of hoops to jump through, a lot of different people to talk to. You really get a good rapport with the interdisciplinary team. I really like the business and hospital administration aspect of healthcare. I like kind of how things run, quality improvement. So I'm hoping to stay in the ICU for some time and see if there's any higher up administration jobs or in quality improvement. Going through the master's, I really enjoyed the business and kind of administration aspect of it. So I would definitely like to explore administration, hospital administration, or quality improvement work within the organization.